Hello, everyone. Thank you so much for joining today's session. I see people still joining, so we'll give it just about one more minute before we get started today. All right, welcome everyone. Hello, thank you so much for joining today's session. My name is Jenna Groman, and I'm the Director of Global Communities of Practice at the Sabin Vaccine Institute. And it's my pleasure to welcome you today to today's event, Empowering Community Voices to Promote Vaccine Confidence through social media and digital engagement as well. As we give everyone a moment to join, please share your name, your organization, and where you're joining from in the chat. During today's session, we encourage you to share questions for the panelists, either in the chat or using the Q&A button. And please also take advantage of the chat feature to ask follow-up questions and engage with others on the call. The Insights Dialogue Project is an initiative of the Alliance for Advancing Health Online. The Sabin Vaccine Institute and Bay Area Global Health Alliance are partnering to support the AAHO in its mission to advance public understanding of how social media and digital engagement can be leveraged to improve the health of communities around the world, starting specifically with vaccine confidence. Insights Dialogue is advancing this mission through a few pillars. First, we are curating research insights on a dedicated microsite, sharing peer-reviewed evidence, resources, and tools, looking at all different ways of using social media and digital engagement to drive vaccine confidence and vaccine uptake. We're also hosting the Vax Up podcast series, which explores the power of social media to strengthen vaccine confidence and shape health behaviors. And then, of course, hosting live events such as this one in partnership with Boost, a global community where immunization professionals connect, learn, and lead, as we look at bringing global perspectives together to examine the use of social media and digital engagement solutions to support immunization programs. And now to kick off today's event, I am pleased to introduce you to our moderator, Nok Nudlovu.
Thank you, Jenna. It's always a pleasure to see familiar names and faces. Hello, Adafunke, Bernadette. I see Emmanuel, a lot of folks from the Boost community, Martha, and across the continent too. Zainab, I see you. Folks from Pakistan represented today. Welcome, everybody. As Jenna said, my name is Mwabizi Ndlovu. I'm in Kampala today. It's a sunny day in Kampala, and we're having this wonderful conversation. We've brought in the experts in the field, as always, talking about empowering community voices to promote vaccine confidence through social media. And as we get underway, I just want to introduce our panelists, starting with Myra Khan, who is in Pakistan. Myra is the head of health communications at the IRD Global. And Fatou Conte is in Cameroon. Oh, sorry, Sierra Leone. Yeah, Sierra Leone. She's the health research specialist at the Research and Adaptive Monitoring Lab, RAM Labs for short. And then we have Rushika Shekhar, who's Deputy Director, Program Delivery and Operations at Project Last Mile, and she's in Cape Town in South Africa. We'll kick off the conversation by me asking a few questions of our panelists, and then we'll get into a Q&A. I hope you'll stay for the whole conversation, because we'll have an opportunity at the end to hear from you in the audience, for you to direct some questions to our panelists. But let's get the conversation underway. And I want to start with Myra. Myra, I understand that IRD Global built online communities to co-create content with community members to address vaccine confidence and increase uptake. Could you please tell us about your approach and the impact that you've seen during this initiative? Myra?
Thank you so much. So our project is really, the ethos behind our project is really about marrying community engagement with online digital presence for scale. So I'm part of the Jilo Dubara team, where we're building digital communities and improving vaccine confidence through really interesting participatory communication activities and sort of building that co-creation aspect to content online. And I'll talk more about that in just a few slides. Next slide, please. So our program is in Karachi, Pakistan. Karachi is the largest metropolitan city in Pakistan and was one of the most hit cities most cities for COVID-19. We have built 6 online communities in 3 high-risk districts in Karachi, and 3 of our communities are on Facebook and 3 of them are on WhatsApp. And we chose these social media platforms based on the baseline that we conducted when we started our program. These were the most used platforms and easily assessed platforms by women. Next slide. So this is sort of the ethos and where we are coming from. Community engagement is a really sort of rich, in-depth way to engage with people, to break barriers and stigma, and engage in conversation and discourse. And so, what we wanted to do that was sort of scale those really rich interactions through digital media and communications, and then connect people through these mobile camps to really push COVID-19 vaccine confidence in a strong way. And so we have about a field team of 14 people that are engaging grassroots leaders, so people of any sort of influence within their communities, men and women who have a key voice. So a lot of times these are polio workers, sometimes we have lady health workers, we have the leader of a religious mosque, etc. And these are a network of volunteers that we engage through different mechanisms, which I'll talk about in a bit, to really help us gain access to these communities and to sort of push the COVID-19 vaccine confidence sphere within the local communities. We host really cool participatory awareness engagement sessions that are really interactive, and we hold Theater of the Impressed sessions, which is interactive theater where the audience is part of the script building and the narrative and story to unpack stigma and barriers against COVID-19. And we sort of have moved these grassroots leaders to our digital sphere, where we are then engaging or creating these local social media influencers and co-creating content with them, because we wanted to sort of harness the power of influence, right? Like we wanted people to gain confidence from people that they knew and already trusted. And so that was sort of the ethos behind where we were coming from, what we were doing. Another thing that was really important to especially engage women, because women were less vaccinated than men, is to create safe spaces. Women in Karachi, Pakistan, were really hesitant to voice their opinions online. They were really scared for their privacy, etc. And so we created a separate safe space for them, which I'll just talk about in a minute. And then we sort of, after engaging these people for a few months, we connected them to outreach camps so that we could see the effects of the confidence that we have created. Next slide. So we have 3 large phases of our project right now. The first phase was where we took sort of, I think, a more traditional approach to working online. So we spoke and connected with a lot of digital influencers that were established, were really popular in the areas that we were working in. These were people with millions of followers. And we wanted to sort of catch into a young audience and crew to build some user-generated content. And so we connected, so it was like we worked with all these influencers, and then we connected our grassroots leaders to this competition. So it was more top-down or digital-led community engagement. And so we had mixed results. It wasn't, people were not latching on to the competition. It was a big lifestyle approach competition, nothing really heavily seated in science communication, etc. The response was, I would say, lukewarm. But so we really had to pivot our strategy for phase 2. So if we can talk about phase 2, the next slide. So in phase 2, we really sort of inverted the pyramid because we wanted to get engagement from the target audience that we were working in. And so we had this large workshop, I think you can see this picture here, where we built the capacity of these local grassroots leaders that we have established relationships with. And we created an online competition for them, which you can see here, where we motivated them to work with their communities, etc., to generate that UGX content, engage people in dialogue, recruit people for our groups, talk to people about COVID-19. And this really changed the game for us. In addition to support that game changer, we launched WhatsApp groups just for women. No men were allowed in these WhatsApp groups. And this really sort of gave women a sense of community where they could ask, women specific questions that, there were lots of COVID-19 questions related to fertility, pregnancy, breastfeeding, etc. And when female only space gave women the privacy that they needed to ask these type of questions. So this was a really key learning for us. So we inverted the pyramid, and so the grassroots leaders, the local influencers that we sort of created online, connected to people digitally, and then took other influencers, etc., that were popular and connected through them. So we changed the flow, you could say, of how we did certain things. Another thing that we did that was important was we strengthened the relationship between community engagement activities with digital. So you can see here that we have these digital cutouts for Instagram frames, Facebook frames, etc. They really encourage people to voice their opinions online in these groups. Next slide, please. Phase 3 is where we are right now. And so we then pivoted after, we had all this really interesting discourse and dialogue. We've now pivoted towards connecting people to these, to COVID-19 camps, getting people to access these resources. We're in the month of Ramadan where everybody is fasting. And so we had to create a different engagement strategy because people are more homebound. They don't want to attend events in public, etc. So we had our grassroots leadership strategy is sort of been like giving people Ramadan packages in groups. And so they're creating these content with the groups about explaining through because of their vaccine. Now that after 2 years, they can have the full experience of Ramadan again, where they meet people, they break their fast together, and have that rich human experience that we took for granted before the pandemic. And then post that, because COVID fatigue has become a huge issue within our population, the COVID-19 notification rates are also at an all-time low. Restrictions have now eased. And so there's a whole sort of focus on living your life again, going out and doing fun things, etc. So what we are doing is that we're going to conduct large-scale on-ground participatory engagement activities. We're going to be doing mural painting, community building. We're going to have stalls at fun fairs, etc., and sort of connect to what people are interested in right now and how the COVID-19 vaccine is allowing them to have these rich experiences again. And we're going to be developing content through those activities. In terms of our impact, if you go to the next slide, please. So far, we have about 900 individuals in our 6 digital groups. We have engaged about 3,400 people through 223 community engagement sessions and have vaccinated about 777 people through 12 camps. And what's really interesting about this data is that in the people that we have vaccinated, about 16% of the people vaccinated are children, and children are historically a place where we have received a lot of vaccine hesitancy. But I think through our project, etc., we've really been able to overcome some of those barriers going forward. So I don't know, how are we on time? I can go through more detail.
We'll come back to that. We'll come back to
right.
that. Thank you, Mara. Very interesting.
Thank you so much.
Very interesting approach. I want to pull in Fatu here because their approach was different. Fatu, your project took a very different approach in providing pre-developed messages to individuals for them to share with their personal networks. What was your goal in doing that, and what have you learned? Fatu?
Hello, everyone. Our team is studying the impact of information sharing on the uptake of the COVID vaccine. Next slide, please. Next slide, please. I will talk a bit on the research team and partners. Now, please, one step back. Sorry, the previous slide. The study design that we are implementing, the interim learnings we've gathered so far, and the planned analysis post data collection completion. The next slide. We are working in collaboration with the Ministry of Health and Sanitation in Sierra Leone and RAM Labs, a local research institution in Sierra Leone, with the University of Chicago. And the research team members are Anne Karin from the University of Chicago, Rachel Glenister, Samantha Kong from Carnegie Mellon University, and Fatu from RAM Labs. In Sierra Leone, only 27% of the eligible population have taken at least one dose of the vaccine, and only 17% are fully vaccinated. And this is 1 year since the introduction of the vaccine in the country. And in a country with very high vaccine hesitancy, social media became a major channel to transmit misinformation, rumors, and conspiracy theories about COVID and the vaccine, especially in urban communities like the capital Freetown, which is the epicenter of the coronavirus in Sierra Leone. And these negative messages are mostly circulated through personal networks like family, friends, colleagues, and neighbors. So the research team, in a bid to influence the uptake of the vaccine through these trusted channels, introduced a pre-developed WhatsApp message that is circulated. We hand them out to participants and clients when they come to the vaccine site, and then they will decide whether to share it with a friend, a family, a loved one, or a colleague. And we try to make the messages simple, easy to understand, and we've also made it in a way that people cannot edit it or alter it, because from experience, we learned that traditional messages sometimes stand the risk of being remodified or maybe wrongly presented in communities. And we also try to make it look authentic by having the Ministry of Health and Sanitation logo on it. So when participants come to the vaccine site and receive a vaccine, we randomize them between 2 groups, a control group and a treatment group. So the participants under the treatment group will receive this WhatsApp image. This is just a sample that is personalized. By personalized, it bears the name of the person that has taken the vaccine. Here it reads, I, Aminata Kamara, Fatu Conte, got a first vaccine dose in January. Here, Aminata is the person that's going to receive the message. Fatmata Conte is the person that has just taken the vaccine and wants to share. And for the control group, we offer them the opportunity to type in whatever they want to talk about the vaccine. It could be their personal status, it could be that the vaccine is free, it could be that, hey, the team is around you, please get your vaccine. So we also give them the opportunity to share what they want to share regarding the vaccine. Next slide, please. Our goal in all this is actually to counter the negative perception about the vaccine and its safety, and to build trust, which will eventually increase in the uptake. And so far, the interim learnings that we've gathered, the implementation is still ongoing. On average, participants shared messages about their vaccination to 2.6 people in their WhatsApp network from an average network size of 12.4 contacts. And the people they decide to share with include both vaccinated and non-vaccinated individuals and a mix of friends and family members. And our preliminary findings suggest that offering a personalized WhatsApp image increased sharing of vaccination status. And then we see also that 26% of people do not want to share at all. And the reasons we've gathered so far why some people do not want to share is because of privacy concerns, or they do not have time, or they have fear of any backlash. A moment, let me just show this now. Next slide, please. And qualitative evidence from our surveys points to for receiving the message. And sometimes we get feedback like, when she knows that I've taken the vaccine and nothing happens to me, she will have confidence and be motivated to take the vaccine. She will know that the vaccine is safe. And another key motivation that we really noted so far is social image. People believe their network will think more highly of them when they know they have taken the vaccine. And some of the feedback we receive from there, like, oh, that I'm so strong, the person will think that I'm health mindful. She will think that I care about her for sending this message to her. I care about her health and her safety. So they will also think I'm responsible. So these are some of the feedback that we're receiving from participants that share the personalized WhatsApp message. Next slide, please. And with the planned analysis, post data collection, like I said, we are still in the process. Our teams are still out there in the field with vaccine teams and working. But after data collection, we hope to measure the effects of the personalized WhatsApp image on the percentage of participants who decide to share, the number of people they decide to share with, and the vaccine uptake of the participants' network. Next slide.
Okay, that's it, Fatu.
Thank you very much.
Thank you so much. We've heard about the traditional approaches. We've heard Fatu talk about pre-developed messages from loved ones and what impact that has. Rashika, co-creation, how does that look? How do you challenge individuals to create content? And how does that amplify reach and impact? Or what did you see in your intervention?
Thank you. So maybe if we go to the next slide, I can just start with a quick overview on what Project Last Mile is for anyone not familiar. So Project Last Mile is a public-private partnership that was formed to answer the question, if you can find a nice cold Coca-Cola product almost anywhere in Africa, why not life-saving medicines? So we look at basically leveraging the private sector and especially the Coca-Cola company's best practices in supply chain and marketing, and looking at how to apply that to the health system. And specifically today, we'll be focusing on talking about some of the work we've done on COVID-19 vaccine demand creation and bringing in some non-traditional approaches based on best practices from the private sector, and giving you an example of some of the work we've done in South Africa around this as well. So if we go to the next slide. So on this very complicated chart that you see on the screen here, this was basically our initial hypothesis when we started focusing on COVID-19 vaccine demand creation in South Africa. And the hypothesis was really that based on available data around vaccine hesitancy rates, as well as general intent to get vaccinated in South Africa, we knew that broadly about 50 to 60% of the population was willing or open to persuasion around getting vaccinated. And the hypothesis was that for that portion of the population, or that big blue bar at the bottom, maybe traditional communications approaches would be effective to help people get the information they need on how, where, and why to get vaccinated. But as the vaccine rollout progressed, we knew that it would become harder and harder to reach specific segments, and you might need more tailored, targeted communications to really help get additional population segments over the line. So if you go to the next slide, what we saw in South Africa was a similar trend play out to the initial hypothesis that when the vaccine rollout started in South Africa and vaccines started to become more available around July, August, September last year, we started doing a large round of traditional mass media communications, leveraging things like TV, radio, and social media as a traditional form of communications. But it was really focused on the general population, maximizing reach, making sure that we were able to have as much communications going on and reinforcing the how, where, and why to get vaccinated. But what we saw, and I think this has happened in many countries around the world in the last few months, is that as the vaccine rollout and the COVID-19 pandemic evolved, the intent and the desire and the motivation to get vaccinated also shifted quite a bit. And we also saw that there were still specific population segments, as Fatu and Myra also mentioned before in other contexts, that were still being left out of the communications. And there were maybe more targeted, segmented approaches required to really reach the segments that had not been reached by traditional mass media communications till date. So we saw that there was a need to evolve our communications approach. So if we go to the next slide. So in the beginning, that first phase of the vaccine rollout, where we were really focused on general population mass media messaging, social media and digital campaigns were used to reinforce some of the messages that we were putting out on other channels. So taking what was happening on TV, on newspapers, on radio, and then using digital and social media to just reinforce that messaging. So this was all messaging that was pre-developed and put out there, and digital and social media was just really used to reinforce the messaging that was already out there. If we go to the next slide. But then what we saw as the vaccine rollout kind of started to slow down was that there were still a lot of segments that weren't really being reached by those communications. And one segment in particular was the youth. And in South Africa's context, this was a population 12 to 34 that was eligible to get vaccinated, but there was still a huge gap in terms of people actually showing up to get vaccinated. And there were some focus group discussions conducted with youth in those age brackets to try and understand what would motivate them to get vaccinated. And what we found was that there was quite a lot of frustration in terms of the communications that a lot of youth had been exposed to. They often felt they didn't really see people like them speaking in their language, the way they speak, communicating to them. It was often very much push messaging from people that didn't look like them, didn't speak like them, that they didn't feel they could relate to. And they often also felt that the communications weren't really coming into their spaces where they were used to talking, where they were used to engaging. And there was a real desire to be more engaged in the conversation as well. So what we did was, in the South African context, look at what kinds of media platforms were being used most by youth and that hadn't really been tapped into for vaccine communications. And through that, we identified TikTok as one of the platforms that had really wide reach across the youth population in South Africa, and looked at, could we leverage that platform to have more two-way engagement with youth in a different way than some of the push messaging that had gone out on vaccines previously. So if we go to the next slide. So what we tried to do on TikTok was, rather than a pure influencer-led campaign, which we had seen had been tested previously and had not had great results, what we tried to do for this campaign was leverage a little bit of a different approach, working on more micro influencers and content creators. So these were youth with pretty small followings, usually under 2,000 followers or under 5,000 followers in most cases, purely on TikTok. And the way these content creators would engage is that they would produce different kinds of content across different verticals. And these were basically different kinds of themes. So they had comedy, they had on makeup tutorials, a lot of different kinds of content. But they produced content in their own format. They had their own audience and they had their own authentic voice that they used to communicate different things. And we gave them a very specific brief on vaccines and gave them freedom to develop creative content in their own style and voice around the specific objectives we wanted to achieve. If we go to the next slide. And what we saw was this approach was quite engaging. We managed to have in the first phase, the campaign content that was put out reached about 12 million views. And in the second phase that's ongoing, we had about 6 million views till date. And this was, again, we gave the content creators the freedom to really work on creative briefs according to their own voice, while making sure that we were able to kind of make sure that there was accurate science-based information going out. But other than that, they had the creativity to produce the content in their own voice for their own audiences. And if we go to the next slide. Oh, I think that's the video playing. You can just skip and go to the next slide. And just to quickly close off, in terms of, I think one of the key takeaways for us from this campaign was that at the beginning of the campaign, it was important to identify what our objectives were for the specific medium we were using. So in this case, we were targeting TikTok, but what was really important was to tailor the message and the messenger. So what message were we putting out and who was delivering that message to what was appropriate for the specific medium or TikTok like we were using, to make sure that it stayed authentic to the platform and we weren't just putting out messages that didn't feel organic and authentic on that specific platform. Let me pause there for time and hand back to you.
Thanks, Rashika. I think I'm finally going to download TikTok. I always thought it was about cat videos, but it's more useful than I thought. I want to shift gears a bit here and speak to all our panelists for the next few minutes. I've heard all of you in a way say that, you know, traditional social media messaging focuses on this push, you know, centrally created messaging out. And what I'm hearing is that there's value in focusing on individual messaging and personal connections. Fatu, let me start with you. Why the focus on individual messaging and personal connections?
In general, Sierra Leoneans value the advice from their family, friends, and network, not only to make health decisions, but other decisions in life, like decisions to do business, education, or anything around life. They will seek and consult their family and friends. And while research may have shown that health workers are the most trusted source for health information, but the family and friends play a key role in reinforcing vaccine information and decision. And in a recent cross-country study that was conducted by Solis and his partners in 2011, family and our friends were among the top trusted sources for information around the vaccine. People trust their family members, people trust their friends. And even from the pre-pilot that we conducted, when we talk with people, somebody will say, well, I will take the vaccine if my friend tells me to, if my sister tells me to, if my brother, I have my brother in Europe that says I shouldn't, but when the person gives me the go ahead, I will. And then, if this person, I know that my friend has taken the vaccine, I will. So because of the kind of trust and belief that Sierra Leoneans have with their close network, the research team also leverage that channel to push in positive information about the vaccine. So that's why we work with close network.
That makes a lot of sense. Myra? Your thoughts?
Yeah, I would just second what Fatu says, right? We are in, Pakistan is a close-knit community centered place. And so, you know, that was really, really important. But I also think what is unique to COVID-19 versus other sort of disease areas, that there was a humongous influx of content that was going through. I mean, the amount of conversation around COVID-19 is unimaginable before in a health space. And so how do you dissect through the clutter And so for us, it was like the most trusted source are your peers and people that you love, etc. And so let's just go through that channel because we feel it will be most effective. And it so far has been for us.
And Rushika, your thoughts?
Yeah, I think to second what Fatu and Myra have already said, I think a big part of, I think especially as the vaccine rollout and the pandemic is evolving, there is a desire, it feels like there's a COVID fatigue also, I think in most cases, and a tiredness of hearing the same messages from the same messengers again and again. And if you are able to use folks that are trusted and word of mouth, there's an authenticity there, and there's probably a likelihood to listen more in terms of, okay, this is someone I trust and know, and this is part of my daily conversation versus something that's just being pushed on me.
I'm hearing the word trust a lot, and that resonates with some of those conversations that we've been having around hesitancy and demand generation. So one of the reasons to feature community members through social media and digital engagement is that it ensures you stay authentic, right, to the community. What did you learn from working closely with community members? Let me start with you, Rushika. What did you learn from the engagement with these micro influencers?
Yeah, I mean, I think you captured it in the question itself in terms of staying authentic. But I think one of the biggest learnings for us, so not just from the TikTok platform, but I think from using a couple of different platforms, is really making sure in terms of the types of approaches you're trying to deploy on digital and social media, there's very different types of engagements people have on different social media channels. So the way someone uses Facebook might be very different from the way someone uses Twitter or the way they use Instagram or the way they access news on digital mediums. And I think there's sometimes a tendency to see digital as one channel that you're targeting, but there's a need to make sure that in terms of the types of approaches you're deploying and the types of content you're using, to make sure that you're looking at what are the objectives for each of these platforms in terms of what are the types of content that people use on the platform organically, so that it's not seen as something that you're just pushing on them that they're not used to on that platform, but making sure you're able to embed in the way they're naturally using that platform, and making sure that you're able to use the right messengers who are, again, trusted messengers. So that can be a friend or a family, or it can be someone that they're used to seeing on TikTok or Instagram, for example. But being able to make sure that you're able to kind of tailor that approach and not see digital as just one big behemoth, and making sure you're also able to kind of segment the approach to each of the channels you're using.
So cutting through that clutter that Myra was talking about. Myra, your take?
I'm going to let Mehek answer this question from the community engagement perspective.
Go ahead.
Sure, thanks. Hi, everyone. I think definitely in terms of the kinds of sort of messaging that we see that is receptive is also heavily informed by the context that communities are currently residing in. So one of the challenges that we had to also think about was, how do women use social media, and how do we tailor our content accordingly? And where we're finding an absence of women online, how can we supplement that by having on-ground engagement? Can we use, for example, women who do have access to smartphones, and they become a bridge for people who don't have access to smartphones? So I think the beauty in contexts like ours, where not everybody has access to social media, is being able to tie that on-ground engagement really well. And of course, something that we also learned from our context is, what is the narrative that your government is also putting out there? Because so much of the information is impacted by that. So you also have to be very careful about how you're phrasing things so that it's not going against what the national stance is, while at the same time, I think we have to acknowledge as public health experts sometimes that during the pandemic, we make mistakes. Right? It's a pandemic. We're all kind of learning and figuring things out. And so sometimes the message that we put out there, it changes or it rapidly evolves. And so we sometimes don't acknowledge that to the end user, who is public, who are the people. And I think social media is a great way to acknowledge that, oh, hey, we made a mistake or we've learned something new. So even though the message we shared a few months ago was different, we're acknowledging where we are now. And I think using on-ground engagement enables community members to even ask those questions and gives them that voice and space to do so.
Wonderful. Let me go to Fatu. Fatu, in West Africa, or on the continent, actually, there's a huge coverage in terms of people using WhatsApp for social connections. What were your learnings from working closely with community members with these pre-designed messages? Fatu?
Yes, from our working with the community members and as well as the vaccine team on the ground, because our enumerators on field staff are attached with vaccine teams that handle the vaccinations, and people may come around, side discussions and comments. We observe that one of the major concerns that people have about the vaccine is its safety. And another concern will be side effects. Oh, the vaccine will harm me, the vaccine will hurt me. If I take it, this will happen. I've heard people say this and all of that. But amidst that concern, people that take the vaccine really want to share to others to erase the misconception. To say, I've taken the vaccine and I'm feeling fine, I'm okay, I'm going on well. So because of that, and we see how people may like to share information, we created a trusted image that people cannot be edited, people cannot modify, or people cannot change. And we also added in the Ministry of Health logo. And it's new and unique in Sierra Leone. While social media is very common, a lot of these messages are going around. But when people see our WhatsApp image, they know this must just come from a trusted source or from the ministry. And even at the time when we were developing it, we were testing it around. And I remember a particular tailor, we said, oh, when I receive this after my vaccination, I will make a print out of it and paste it in my shop so that anybody that will come in we know that I've taken the vaccine. Some people maybe want to almost relate it to the vaccination card. So that's how authentic it was seen and received by the people in Sierra Leone. So we had to even talk to people and say, no, this is not equal to your vaccination card, but it's also an authentic testament that you have taken the vaccine. And from my experience with childhood immunization, we learned that people care about how others view them, to see that, oh, I'm a very caring parent, so they will to pursue and take the vaccination. And for COVID, this can also apply, where people have social image motivations to share the vaccine image, especially when they say, oh, this is fine, this is.
We've lost Fatu there, but I think the message is clear. People care how they're seen, and working with authentic voices is important. Thank you, Fatu. To wrap up, I want to ask our panelists in a few seconds each, what is the lesson that you've learned from the projects that you've presented to us? What's that aha moment that you want to share with our audience, and hopefully they can take it and implement it in their own work? Let me start with Myra, and then I'll go to Rushika. Myra?
It's a really difficult question. I think what's really important is to engage both men and women through the digital platforms, and it is more difficult to engage women, moving forward. But however, if you create a safe space for them, if you create sort of a female-centric space, etc., I think it is a really powerful place for you to make change, because they really do, have a lot of influence at home. I think a second piece is
just one.
Oh, sorry. Okay, one. That's it. One.
Safe spaces is an important thing to create. Yeah. Thank you, Myra. Rushika? 5
Oh,
seconds.
I was going to try and sneak in 2 as well, but I'm seeing I can't now. No, if it's just 1, I think in terms of where we are in the pandemic, it's about being making sure your approaches can adapt as the communications needs evolve. So leaving enough flexibility to integrate the feedback you're getting from these kind of digital approaches and allowing your campaign enough flexibility to evolve. Because I think a lot of traditional communications campaigns, you invest a lot upfront in production and things like that and media buying, and that doesn't leave you as much flexibility to really change the types of communications you're putting out there. But if you're able to set up the campaign to allow yourself enough flexibility to take in the feedback you're getting from the community, change the types of approaches you're putting out, that's going to be really necessary in terms of, I think, wherever you're implementing COVID-19 communications going forward.
Be open to learning, so important. Fatu, finally, we'll close with you. What's your lesson?
Yeah, thank you very much. So one of the key learnings is that people may not like to share as much as they should. So creating, bringing up or developing an encouragement or introducing an encouragement for people to share will help increase and push out more positive information about the vaccine. It is also good to identify the right guidelines. What's the channel that people are using to spread misinformation about the vaccine? And see how you can also follow through the channel to introduce positive messages. And maybe finally, it's also good to work with the right team. Like we are working with the vaccine team, they see us around, and that kind of build credibility around our work. Thank you.
So don't reinvent the wheel and get trusted sources in the forefront. Thank you, Fatu. As we close, I want to give voice to some of the questions that have been posed by our audience. I think we'll have 2 or 3 questions for our panelists. And the first question is from Mohammed. Mohammed Sako says, my concern is how to sustain the program in underdeveloped countries where these facilities are not available to most of the communities. I think this is talking to technology and so on. I'll direct that to Myra.
Yeah, I'm going to redirect this to Mehek, who runs the community engagement aspect of the program.
Hi again. I think, again, what some of the programs here are doing is building that strong connection with local persons on ground. For example, what we did in our project was build very strong relationships with grassroots leaders. And what that does is that we want to enable a sustainable platform. And because there's social media groups that, by the way, are not specifically branded for COVID. Even the names that we gave to the groups are like basically a collective of people. So the idea is that the group could be used for any health communication going forward. At the moment, we're focusing on COVID, but people are already engaged on it and they could expand that to other health topics. And I think that's one way to do so. And the advantage is that these platforms are free. If you have a profile on Facebook, you can use those Facebook groups. And if you have a phone that can connect to WhatsApp, then you can sustain that. And like I said, what I had mentioned earlier, being able to be connected to an on-ground movement just enables that reach expands beyond those who have access to smartphones. I hope that answered your question.
I just also want to add just to what Mehek said, what's important is building that sense of community. So the togetherness, coming together, especially, and in our context, is really important because that sense of community was fractured of COVID-19 due to the we had so many lockdowns in Karachi. And so people coming together and that sense of community is really, really important to our culture. So that's also important.
Thank you, Myra. Rushika, there are about 3 questions that I want to pose to you. Hopefully you can give one response to them. First question is, what challenges have you faced in creating user-generated content, and what platforms do you recommend? And there's a cost kind of related question to that. And Bernadette says, what are the financial implications of digital messaging? And she asks, because digital messaging is costly in her context. Rushika?
Great. Let me see if I can loop that into one answer. But so in terms of some of the challenges with user-generated content, I think initially one of the challenges was just looking at how to moderate that content and make sure that it was accurate and anything we're putting out is kind of verified and we're not supplementing some of the myths and misconceptions that are going out there. So I think just setting up a platform and leveraging, there's digital agencies out there that have very robust protocols in place for verifying different kinds of content creators and user-generated content. So there are a lot of cost-effective platforms that you can use to make sure that the content is accurate and going out there correctly. So I think that's a potential challenge, to just make sure that user-generated content is moderated effectively and having in place protocols to do that before it actually goes live. In terms of the platforms, this really depends, and I think it should, that should be a huge assessment. Doesn't need to be a costly assessment, but it should be an assessment that's done depending on the communities that you're working with. So in the context we were working in South Africa, for example, TikTok was a very effective mechanism, but we're working on similar programs in Malawi and Eswatini where TikTok is not as prevalent. So we wouldn't recommend that platform for the same context, even though they're neighboring countries. So I think it's about just making sure that the platform you use is relevant for the communities you're serving and the communities you're working in. And then in terms of cost, so one of the reasons we actually shifted to a lot of digital mechanisms is we did find that digital media was more cost effective than other types of media. So when we look at, for example, TV buying, radio buying, editorial, those kinds of traditional mass media that really help you have really big reach, you can actually have much more cost effective ad buying for digital platforms like Facebook, Twitter, Instagram, and TikTok. And you can start ad buying for pretty small amounts, less than usually $500 to $1,000 even, to just test out the approaches. So we did find that digital media ended up being more cost effective than some other platforms. And especially if you're using user-generated content, there's also no production costs involved. So that also helps you limit your costs and the investment you need to get some of these campaigns up and running. I hope I answered the questions.
Yep. Thanks, Rushika. And I think this one I'll give to Fatu, because she spoke a bit about the importance of having logos and so on. Fatu, Errol asks, the same social media platforms and mediums are used to spread fake news, disinformation, and rumors about COVID-19. How did you manage to counter this? And is there a way to measure that the right information is not fake, essentially? Fatu, your response to that question?
Yes, please. So that is one major problem and one of our motivation for even implementing the study, because of the misinformation and the rumors, all these conspiracy theories that are circulating through WhatsApp, and it's really prevalent in Freetown. So something that we did, or we're doing now to counter that, is to really push out authentic. Wherein we have the name of the person that is sending the message and the person that is going to receive the message. This is not common in most of the messages that are circulating in Freetown or through social media around the vaccine or about the vaccine. So because of that, we also have like the Ministry of Health logo on it, all kind of combined to validate that the information that is coming from us or coming from our participants is authentic and not just among part of the rumors that are flying around.
Thank you, Fatu. And thank you to all our panelists. Unfortunately, we have to leave it here. Martha, Lena, Bernadette, and Odigi, your questions, I think we'll try and answer those in a separate platform on the Boost platform. Jenna will tell you where to find it. But let me just take the opportunity to say thank you to Myra, Fatu, and Rushika, and I saw Mehek jumped in a few times, as well as Anoki. Thank you all for your time and your wonderful contributions. Back to you, Jenna.
Thank you. And I want to echo Nok's thanks first to our panelists for today. Just really exciting conversation and really fascinating to explore how this was really applied in some different ways and in different contexts, and those learnings that can be then applied and extrapolated to other countries and other needs as well. And thank you as well to Nok for, as always, your expert facilitation and the wonderful questions that you posed throughout this session. Finally, thank you all for joining today and for the questions you posed to our panelists about the topic. As mentioned earlier, this event is part of a broader initiative, and we invite you to stay engaged with Insights Dialogue and to follow up on this session as well. You can explore relevant resources at insightsdialogue.org, as well as join the Insights Dialogue Learning Group in the Boost community to stay connected and informed of upcoming events. Through this learning group, we will also be sharing, as Nok mentioned, responses to the questions that we did not have time to get to today. So we will make sure that we address all of those questions with our panelists and share that back out with you all. Our conversation next month will continue as we explore social media strategies to build confidence in youth vaccination. This is really, I think, really quite interesting, especially building on today's conversation and the work Project Last Mile did in South Africa to dive into that really a little bit more and explore different ways that organizations have worked to reach youth and motivate them to get vaccinated, both for COVID-19 and for routine vaccination as well. So please register to join us on May 17th for this conversation, and take a moment as well to take our post-webinar survey for today's event, share feedback, and help us shape future events. I also want to share a few additional upcoming events that will be of interest. We have 2 upcoming events from the Boost community. Tomorrow, we have a really interesting session on COVID-19 vaccine demand planning and product choices, tools and learnings for immunization. And in this session, you'll learn about vaccine product choices and gain advice and tools to optimize your vaccine portfolio. And then on April 27th, we'll have our next Bright Spots webinar featuring a journey to launch an HPV vaccine campaign targeting adolescent girls in Ordos City, China. Finally, a reminder that the Sabin Vaccine Institute is now accepting nominations for the Albert B. Sabin Gold Medal and Rising Star Award. We welcome nominations of extraordinary contributions to immunization and global health. Nominations are due soon. They're due by Monday, April 25th. So please submit any nominations for that. And then finally, Boost is partnering with the WHO for an upcoming COVID-19 Recovery for Routine Immunization Program Fellowship. This will be an in-depth fellowship for both national and subnational immunization professionals. Registration details will be coming soon for that. So please join the Boost community to make sure that you are that we share that announcement with you and the application when it is available, which will be coming in the next several weeks. So thank you again to everyone for joining today. We so appreciate your participation and really looking forward to continuing this conversation online and through future sessions. So thank you, and I hope everyone has a great rest of your day. Bye-bye.
Thank you. Bye.
Thank you, everyone. Bye-bye.